Hi, Dr. Dave Webster, and this is part 2 of what I've said before is a very, very critical video, and this is on what's happened to Carol. It was an archetypical example of what I've seen happen to patients. Tens of thousands of them would have happened over the past 15 or so years in Ontario, and the horror of what is 100% due to the actions that doctors in Ontario are forced to practice based on Cancer Care Ontario McMaster-based standards. So I ended the last part 1 by saying what in fact did Carol's PET-CT show and what were the implications for not having this PET-CT before the therapy. And as you watch this, I want you to consider the following question, and that is what you see is happening to Carol here. Is this really just seen as a success story by the Liberals, Ms. Wynne, Dr. Hoskins, and their experts? I mean, is this simply a confirmation that their efforts to discredit, delay, and block PET are in fact alive and well in Ontario? So this, in fact, is what we call a three-dimensional rotating image, a MIP we call it. This is her brain up here, kidneys and things. But the point is these dark spots, we'll have more detail about it as we look at various scans, but these shouldn't be here. These are sites of cancer. But remember, this was done after Carol's therapy. And again, just keep in mind that because I tried to prevent what you're about to see from happening to Carol, I was threatened by the loss of my hospital privileges directly by the government, Cancer Care Ontario, and it would appear also, sadly but not unexpectedly, by the College of Physicians and Surgeons of Ontario. Now, this example, I believe, will drive home why PET-CT has, in fact, been the world standard for so long. What it demonstrates is that even if it had been possible to offer Carol a cure, the left pelvic node, remember, where the CT said, I don't know, could be, could not be cancer, weren't sure. In fact, it did have cancer. But the radiation oncologist, understanding the effects of radiating tissues that don't have cancer and the implications of that, as you will see, undertreats that area. So it doesn't have a curative treatment. So what you'll see here, in fact, this red arrow shows here, that little area in there, it's just a little bigger and a little regular than it should be, but remember, CT and MR are just based on size. So here's your PET-CT, the fusion of it, and I need a physician to know that there's something very abnormal there, and in fact that represents cancer cells eating and confirming that there was cancer there, and they're eating sugar. But in addition, and again, you'll see here that this is her CT. This, in fact, is an absolutely normal-sized lymph node on the right side of her pelvis. This is her pelvic bone here. And remember, CT could only, and MR will only report something if it's abnormal in size. If it's big, they don't know what it means, but just this would never have been even commented on. But guess what? I mean, again, you don't need to be a genius or a physician to know that this is abnormal, and in fact it would contain cancer, but there was no attempt to try and obviously radiate this area with a curative dose of cancer. So now she can't have any more radiation, at least a curative, to her pelvis, because as you'll see the effects of even a normal tissue from the radiation exposure. So she won't be able to kill these cancer cells, and even if a cure had been possible, this opportunity is lost forever to Carol, exactly and directly because her physicians were not allowed to do a PET-CT on Carol. So, and it turns out, however, that isn't entirely the bad news. It definitely isn't the bad news. What her PET-CT shows is that she unfortunately already had untreatable stage 4 disease. We can see a lymph node higher up in the abdomen here. This is actually the kidneys here. This is normal bowel over here. There's abnormality in her right adrenal gland here. That's her liver there. And even she has early lung metastasis. Now, does anyone watching this video not know that the experts that have been told to discredit and delay block PET don't know this information? Remember, their job is to discredit and delay and block PET. And you really need to think about that, because this truly is the kind of people who make healthcare decisions about you in Ontario. So, for Carol, her false hopes for a chance for a cure based on her CT and MR weren't even possible from the beginning. The implications is that her radical radiation therapy was absolutely contraindicated. It never should have taken place. It had no chance of working, and she went through horror and all that experience in that machine and the side effects for absolutely no reason whatsoever, except to meet the agenda of whatever the Liberal government has told its experts to come up with. So now, besides having to deal with going from a possible cure to terminal cancer, remember, she's now going to have to live with these complications. Yes, they'll get better, but they'll never go back to normal, these tissues, as you might expect. Now, the point is, this absolutely would not have happened to Carol if the cancer care and their McMaster colleagues weren't solely focused on discrediting, delaying, and blocking PET for their political masters. Now, this is what PET does. It was bad news. It would have said, Carol, from day one, we really don't have a chance of curing you. It would have had other possibilities when we'll consider something called palliative therapy, but again, because she lives in Ontario, this simply isn't going to happen. I'll have another video on how we can follow palliative therapy patients with PET. But it turns out her misery doesn't in fact end there. So what she's going to have is another teleconference with her McMaster guru surgeon. Remember, McMaster's the basis of a lot of this. And she confirms, yep, stage 4, doesn't make any comment about how the CT and MR were wrong. She can only apply now for palliative therapy. What palliative therapy means is that, it's not for cure, but hopefully they can prolong Carol's life, and hopefully with some quality of life, which is not going to be quality of life because, of course, she has all these bad complications from her radical radiation therapy, which was contraindicated. But Carol, being a nurse and well-informed about the issue, she asks the obvious question, so now that I'm here, will I be able to be followed by PET scans? So this guru surgeon doesn't even miss a beat, looks her straight in the eye and says, you will only be allowed to have a PET CT scan if the CT exams are not definitive. But wait, isn't this the reason Carol is in this living hell? Because her CT scans weren't definitive? And in fact, as I've shown before, they are incapable of being definitive. And do you think these people that are directing Carol's treatment and deciding on what she could have PET access or not don't know this? They're all very proud of this, remember. So again, a question I've asked before, were Carol's physicians, including myself, forced to practice incompetent medicine, which for Carol truly is an assault on her body, not just physically, but more importantly, emotionally? So the summary of Carol's experience in our Wynne Hoskins liberal, evidence-based, patients first healthcare system, courtesy of, you guessed it, Cancer Care Ontario, our future built with care, and of course their colleagues from the McMaster University School of Evidence-Based Medicine. And again, the summary of this case, it demonstrates, I believe, why PET-CT has been the accepted world standard of imaging management for cancer, many other diseases, dementia, post-traumatic head injury syndrome, similar, serious diseases as long as 20 years ago in the case of lung cancer, and in places like Chile and Argentina, but not Ontario. And of course, as I think you're going to understand now, it's this kind of thing done to patients which led to unprecedented accusations of unethical, bordering on immoral actions against our patients, and by an agenda-driven process directed at our Ontario's patients. And in my recent communications with these various people, no one has ever questioned the validity of my statements such as this. They just don't want me to tell you about it, or I will lose my privileges in a hospital and possibly my privileges to practice medicine in this province. This truly is the kind of open, transparent, accountable democracy you'd like to call home? I hope not. Now, it also, I think, demonstrates in spades the cold-hearted callousness of our politicians and their experts making these decisions. And I can assure you that Ms. Wynne and Dr. Hoskins are fully aware of Carol's situation, as are the Cancer Care Ontario, the senior executive and the physicians involved, along with the board of directors of Cancer Care Ontario. But Ms. Wynne, I can assure you, will not even acknowledge Carol's suffering. I said, so, Ms. Wynne, what do you have to say to this poor woman? Doesn't even acknowledge she exists, passes it off to Dr. Hoskins, who will equally well ignore her. So back to the original question. At the beginning of this particular blog, I asked, is what Carol is going through to this day seen as a success story by the Liberals and their experts? I mean, is this the price that Carol and the rest of her patients must pay? So to guarantee the actions to guarantee the ongoing success of their efforts to block PET-CT for Ontario patients. I ask you to consider that. Now, my next video, it's going to be very interesting, I think you'll find, and that is, this is Dr. Margaret Chan. She has been the Director General of the WHO for, since 2006 to 2017. All the issues around SARS, Ebola, and so on all came through Dr. Margaret Chan. Turns out Margaret's a classmate of mine. So look forward to what she has to say about what it means to live in Ontario and try and advocate for patients. And let's do something about this. Thanks.